Many years ago, there was no such thing as UCNS certified headache specialists. It was just people who were interested in headache. And they self-define themselves as a headache specialist. And many neurologists see a lot of headache, but they're not necessarily headache specialists. I consider a headache specialist as somebody who's taken an active interest in headache, attends meetings that help you understand the scientific underpinnings of headache, and also people who've taken initiatives to learn more about headache, be enthusiastic about treating headache, and really they have to have a true interest and passion to take care of patients with headache. A neurologist may see headache patients and be able to rule out a secondary diagnosis, but unless they are really interested in headache, they may not be up on all of the latest treatments, medications, devices, etc. for people with headache. Well, not every headache sufferer needs a headache specialist. There are wonderful primary care doctors that take care of patients who have some interest in headache, or at least enough interest in headache that they can help take care of many primary headache disorders. But when a headache becomes more frequent and treatments aren't working, or the diagnosis is not clear, then it's time to see a headache specialist. But I want to urge people to think of their primary care person as their friend in this arena, because a headache is a primary care problem. It's as common as asthma and diabetes combined, and primary care specialists are trained to take care of asthma and diabetes. We may not have been doing the best job of training every primary care provider in headache, but we're working on it. Well, I think if people have really difficult histories, a new headache and somebody who's not headache prone, who's there's no obvious cause to the headache, I think those people deserve extra special attention. I think people who have complicated types of headaches where they get weak or numb or have difficulty speaking, people who have unusual symptoms like prolonged auras or status migrainosus, and sometimes people who have got complicated medical problems that are comorbid with chronic headache, those people may need a specialist. Some people with comorbid psychiatric conditions sometimes need to see a headache specialist to kind of sort out all of their different problems so that it's much more manageable to treat. Well, I would say everyone should talk to their primary care doctor and say, you know, I've tried all these medicines, I'm not seemingly getting anywhere. You know, what would you suggest that I do? And if they say, well, keep trying medicines, okay, but maybe talk with them about, well, is there somebody who's interested in headache in our area that you would recommend that I see? And usually primary care physicians have networks of people they refer to and know where people can get a good opinion. If you're on the fence about it, talk to your primary care provider, because they will help you decide whether you've tried everything, or they may have a whole list of things they're planning to do already. And I think one piece of advice in talking to the primary care provider is sometimes people need to set up an appointment just to talk about headache with that provider, because some primary care providers have like 15-minute appointments, and that has to cover all your prevention, any medications you're taking, your exam, your annual, everything else, and that's just not enough time to really understand or talk about headaches. So I recommend you first talk to your primary care provider about your headache alone. Just say, I'm making an appointment just to talk about my headache alone. And then at the end of that, maybe the two of you will decide together, you know, yeah, maybe you should see a headache specialist. It may take a while to get in.